Now to the latest on COVID-19. Cases are rising in nearly half of the country. You can see it on the map. Some hospitals say they're in crisis mode. This is California is joining Colorado now in encouraging boosters for all adults without waiting for CDC approval. Joining us now for more on this, and we are happy to have his expertise here, physician at Stanford Children's Health, Dr. Alok Patel. Thanks so much for joining us this morning. Do appreciate it.
Thanks for having me on, Phil.
Yeah, it's always good. With cases rising, as we said, in nearly half the country, two-part question. How bad could this surge get? We are now in the winter, pushing people to get their flu shots as well. And how worried should families be about the Thanksgiving gathering, which you know people are going to have?
I feel like those are, we can make that one and the same question, because I think the good news is that this is not going to be as bad as last winter in terms of total deaths. We have a lot more people vaccinated. We didn't have a vaccine at all. But Phil, as you know, this is the year of the Delta variant. It was more of the Alpha variant last winter. Delta variant's far more contagious, now representing 99% of cases worldwide, which is going to be a factor here because at the end of the day, we still have more than 40% of this country not fully vaccinated. So as families are trying to, fly across the country, gather indoors, it's something people need to keep in mind, especially because they still have some family members, especially these young kids who aren't vaccinated. And there's a lot of communities in the country that have high transmission, low vaccination rates. So a lot of variables at play right now. And we're seeing an unfortunate situation play out in Europe. That's what we're trying to avoid.
Yeah, and as for Europe, we just saw a pretty bad surge in the UK. I know that over the last year and a half, we in this country have looked to other countries and said, what's coming next? Is that coming here next? So is that coming here next?
I think the potential is. I think it's difficult. It's always been to compare the United States to Europe, whereas they have multiple smaller countries. We are much larger. We have completely different dynamics in terms of our geography and politics. But, one thing that really struck with me, yesterday, Politico Europe reported the chancellor in Austria called a 65% vaccination rate shameful. We're 59%, according to the CDC COVID data tracker, which is shameful in terms of how well we know the vaccine works and how incredibly available it is and how many other countries wish they had this type of resources. So that is shameful.
Right. And to follow up on that, we heard just this morning that Austria is on the verge of placing millions of unvaccinated people in a nationwide lockdown, obviously because of the statistic you just gave. What do you think about that? Obviously, certain countries can do certain things because of, their Bill of Rights or not. But what do you think about that here?
I don't think that we would actually get away with that on the state level in terms of having a lockdown for people who are unvaccinated. But I do think that this pushes forward the narrative about the mandate for vaccines in this country. We've already seen that play out. We've got the November 22nd federal workers deadline. And I think there's even more evidence now about why that may be a good thing. A lot of those early protests we saw against the vaccine mandates, more than 90% of those employees, United Airlines, Tyson Chicken, a lot of those hospitals went out and got vaccinated because they know what they're trying to prevent.
We're talking about hospitals. On the introduction to you, we said that, hospitals are saying that they're being pushed to the brink. Most hospitals saying they're seeing the majority of people hospitalized unvaccinated, but we are seeing vaccinated people in the hospital. So for folks at home who got their vaccination and think that they're protected, feel that they're protected, don't think they're going to wind up in the hospital, why are we seeing vaccinated people wind up in the hospital? Is that because more people are getting vaccinated and it's a number thing, or breakthrough cases? What's the deal there?
Phil, with the statistical pearl.
Boom.
You're 100% correct. I mean, when we have a larger proportion of people who are vaccinated, you inevitably will get a larger proportion of people who are vaccinated who wind up being hospitalized. We also have the factors of waning immunity. There's also some statistics about those who are being hospitalized and vaccinated being older, possibly immunocompromised. And, the really scary reality is that hospitals were full during winter before the pandemic. That's always been a thing. So we don't have the bandwidth for another surge right now. I'm working at several ICUs that are full. And it's not even because of COVID. That's because of life. That's because of our healthcare system.
Everything else that's happening.
Correct.
Without the pandemic.
Without the pandemic. We got that on top of it.
Dr. Alok Patel, thank you so much for coming in. It's good to see you in-house.
It feels like 2019.
I know, doesn't it? Way back when. All right, Doctor, thanks so much.
Thank you.
Appreciate it.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.